Welcome back to the Deep Dive.
Great to be back.
Today, we've got quite a pile of sources. We're talking CTV News, Sweden Herald, Dev Discourse, a Bulgarian news source, too.
Mm-hmm. And a briefing document, plus an academic paper focused on elderly care.
Right. And we're going to unpack something really, really tough today, but important. These recent discoveries of illegal nursing homes in Bulgaria, just horrific conditions.
Yeah.
Our goal is to really understand what went down, the full picture, and maybe what it tells us about the bigger systems meant to protect vulnerable people.
Exactly. These sources taken together, they paint a deeply disturbing picture. It's not just one event, it exposes a kind of hidden crisis.
Mm-hmm.
So by pulling out the key facts, connecting the dots, we can see the immediate tragedy, obviously, but also maybe the underlying conditions that let this happen.
Okay, let's start there. What exactly was discovered? The main event seems to be authorities finding these illegal facilities.
Yes.
The Sweden Herald says 75 elderly people were rescued, and that was from 2 homes, right, in just 1 village.
2 homes, 75 people. Just think about that number for a second.
It's huge.
It immediately tells you this wasn't some tiny isolated thing. These were significant operations, housing dozens of people, totally off the radar.
And the descriptions. Bulgaria's Minister of Justice, Georgiev, apparently called them houses of horror.
Houses of horror, yeah, the phrase comes up. When a government minister uses language like that, I mean, it sets the tone for just how bad it was.
And the specifics of the abuse, they're hard to read, frankly. Multiple sources are talking about physical violence, beatings.
Yes, beatings are mentioned repeatedly, and also being bound or tied up.
So actual physical restraint.
It seems so. Not just neglect, but active cruelty, almost designed to control people.
And the living conditions themselves, just basic conditions.
Appalling. The Sweden Herald mentioned people locked in dirty rooms without bed linen.
Without bed linen.
Yeah. Dev Discourse talks about appalling conditions, too. It's just complete deprivation, utterly dehumanizing.
Gosh, there was one detail in the Bulgarian source. It said that the doctors and social workers who went in to check,
Oh, yeah, I saw that.
they were apparently crying when they left one of the places.
Right. Imagine seeing something so awful that trained professionals, people who must see difficult things sometimes, they're just reduced to tears.
It really hits home how bad it must have been. One source even said the conditions violated all human rights.
Yeah. Which brings us to something even more disturbing, if that's possible. The drugging.
Ah, yes. Multiple sources mention this. Residents being sedated.
The Sweden Herald puts it bluntly.
Yep.
Allegedly beaten, bound, and sedated.
And the Bulgarian article gets more specific: people drugged or under the influence of strong narcotic drugs.
And crucially, look at this detail.
Yeah.
These drugs were given without the people knowing, the hospitals knowing what they were receiving.
So secretly drugged.
Secretly drugged. They're doing blood tests now, apparently, trying to figure out exactly what substances were used.
That deliberate secret drugging, it just takes it to another level, doesn't it?
It really does. It shifts it from, neglect or even random violence to a calculated system of chemical control.
To keep them quiet, manageable.
Exactly. If you keep residents sedated, they're less likely to complain, less likely to resist, maybe less likely to even try and get out. It makes them easier to handle in the most awful sense.
Yeah.
Easier to abuse without anyone finding out.
And this was happening alongside reports of unlawful imprisonment.
Yes, Dev Discourse uses that specific term, unlawfully imprisoned.
Right.
So they're being held against their will
Wow.
and chemically subdued to make sure they stay put.
Are there specific examples?
Yeah, the Sweden Herald had a couple of really heartbreaking ones. One elderly woman apparently hadn't left one of the homes in 4 years.
4 years, just inside.
4 years trapped. And another story, a resident who actually tried to escape was caught
Oh. Oh.
and then severely beaten as a punishment, presumably.
That quote from CTV News just sums it up, doesn't it? They lock us up like dogs.
Yeah. It's gut-wrenching. Total lack of freedom, dignity. It wasn't care. It was imprisonment, violent imprisonment, made easier by drugging people.
So, okay, we have these horrific places, dozens of people trapped, abused, drugged. The big question then is how? How does this even happen? How do places like this operate completely under the radar?
Right. And this is where the sources start pointing towards bigger systemic problems.
Hmm.
Because these weren't just badly run homes, they were illegal homes.
Operating completely outside the system.
Precisely.
Okay.
That's fundamental. They were bypassing all regulations, all oversight. They can charge fees. The Sweden Herald mentioned something like over 4,000 kroners a month, so not insignificant,
Right.
but operating with zero inspections, zero standards. They were essentially exploiting a gap.
And that gap exists because...
Well, the sources suggest it's linked to broader issues in Bulgaria. Sweden Herald notes, Bulgaria is the EU's poorest member state, and it faces criticism generally for inadequate care facilities. There's a real shortage of legitimate, regulated, affordable places for elderly people or those needing care.
So a lack of proper options creates demand that these illegal places then fill.
It creates a desperate situation for some families. If you can't find or afford a legitimate place for a loved one who needs care, well, that desperation can be exploited. These illegal operators step in, promising care, but cutting every single corner imaginable, including basic safety and humanity, just to make a profit. They fill a vacuum left by an overburdened system.
And it sounds like even the legitimate system is under pressure.
Yes, that's a point from Dev Discourse. It mentions that even registered elder care providers are struggling. Escalating costs make it hard to maintain standards, which suggests, wider crisis in providing adequate care across the board. Economic pressures affect staffing, training, resources in any facility. But obviously, in these illegal homes, that pressure isn't just felt. It's sort of the entire business model: zero investment in care, maximum exploitation.
Which really brings us to the issue of oversight, or the lack of it.
Exactly. How could 75 people be kept in these conditions in 2 places in one village without anyone stopping it sooner? It just screams systemic failure.
Were there supposed to be checks? Inspections?
That's the question. Were they happening? Were they effective? Did the regulators even have the resources to find places operating completely off the books?
That detail about the inspectors crying.
Yeah, it's powerful, isn't it? Not just emotionally, but it maybe indicates that the reality was so far beyond anything they expected, or maybe anything the normal checks and balances were designed to catch.
Like these places were completely outside the scope of normal oversight.
Possibly. Or maybe the oversight mechanisms themselves are just inadequate for the scale of the problem or the depths of the potential abuse.
And we have that academic paper, too. It wasn't directly about this case, right? It was about COVID-19.
Right, focused on COVID in Bulgarian elderly institutions. But its conclusion is really relevant here. It independently found a clear need for urgent change of policies in the long-term care and nursing home sector.
So academic research backs up the idea that this isn't just about a couple of rogue illegal homes, but deeper structural flaws.
Exactly. It adds weight to the argument that the entire system, funding, regulation, oversight, needs serious reform. The vulnerability of people with severe health issues is just amplified massively when the support systems are fragile, or, in cases like this, completely absent and replaced by exploitation.
Thankfully, once these places were discovered, the authorities did seem to act quickly.
Yes. The sources mention arrests, 5 or 6 individuals detained, apparently.
And investigations are ongoing. Kidnapping, violence, abuse.
Yes, it sounds like they're pursuing multiple serious charges now that the scale of it is clear.
It's just looking across all these sources, different news outlets, different countries, the briefing doc, the academic angle, they all paint the same incredibly grim picture.
The consistency is striking, isn't it? The physical abuse, the binding, the drugging, the imprisonment, the squalor. It's all there, again and again.
And they all seem to point back to those same underlying issues. Poverty, not enough proper care options, economic strain, and a massive failure of oversight.
That deliberate drugging part, using strong narcotics, it just keeps coming back to me as highlighting the calculated cruelty.
Yeah.
It wasn't just neglect through indifference. It was an active strategy to control people, to keep them subdued, to prevent escape or exposure. The fear they must have felt.
Unimaginable. And while, Bulgaria's economic situation, being the EU's poorest country, isn't an excuse.
No, of course not.
It is important context, isn't it? Social systems like elder care are inevitably going to be under huge financial pressure.
Absolutely. And when you have that pressure, plus maybe demographic changes leading to more need for elder care, but the legitimate system can't cope affordably, well, it creates that perfect storm.
Where illegal, exploitative places can thrive.
They step into the void, preying on desperation. It just underlines how vital proper funding and robust public policy are for protecting the elderly and vulnerable.
So wrapping this up, this deep dive has really exposed the brutal reality inside those illegal Bulgarian homes. The violence, the drugging, the imprisonment, the absolute lack of dignity.
Yeah, it's stark.
But looking at all the sources together, we also see pretty clearly, I think, that these horrors weren't happening in a vacuum. They seem to be symptoms of much deeper problems.
Definitely. A shortage of proper facilities, huge economic pressures on the whole care sector, and, critically, a breakdown in the systems meant to regulate and oversee these places.
It's such a powerful and deeply painful reminder of how vulnerable elderly people or anyone needing significant care can be when those safeguards fail.
Or just absent altogether. It just screams out the need for strong rules, yes, but also active monitoring and real investment in care facilities. Not just in Bulgaria, I mean everywhere. Rules on paper don't mean much if they aren't enforced, or if the system is so starved of resources it can't function properly. Accountability is key.
And for you listening, these details are incredibly disturbing, we know that, but they really do highlight the conditions that vulnerable people can face globally. It forces you to think beyond the headlines and maybe ask, how do we make sure this kind of thing isn't happening or couldn't happen closer to home? What protections are really in place for those who depend entirely on others? Are those protections truly working or just assumed to be?
That's a crucial question, something definitely worth thinking about.